Today, we'll explore mastoid obliteration, a surgical procedure used in the management of chronic ear diseases like chronic otitis media with cholesteatoma. This procedure helps prevent recurrent infections and improves surgical outcomes, particularly after a canal wall-down mastoidectomy. The mastoid is part of the temporal bone located behind the ear and contains air cells connected to the middle ear. Chronic conditions such as otitis media, cholesteatoma, and mastoiditis can cause these air cells to break down, necessitating surgical intervention. Mastoid obliteration is indicated in cases of recurrent or persistent chronic otitis media, recurrent cholesteatoma after prior surgery, and persistent cavity issues like frequent infections, discharge, or difficulties with hearing aid use. The main goal is to reduce the mastoid cavity size for easier management and to prevent water trapping. The procedure aims to eliminate the mastoid cavity to lower the risk of infection, prevent the formation of retraction pockets and cholesteatomas, and improve the patient's quality of life by reducing the need for frequent cleanings and infections. The procedure starts with clearing the ear canal and mastoid cavity of any disease or debris. The choice of obliteration materials includes autologous options like bone pate, cartilage, fat grafts, or temporalis muscle flaps, and synthetic materials such as hydroxyapatite or bioactive glass. The obliteration material is placed in the mastoid cavity to fill the space and stabilize the structure, sometimes accompanied by reconstruction of the external auditory canal. Post-surgery, patients typically receive antibiotics to prevent infection, and the ear is kept dry with temporary packing to support the new structures. Follow-up involves monitoring for infections and ensuring the obliterated cavity remains healthy. While mastoid obliteration can significantly reduce recurrent infections, potential complications include recurrence of cholesteatoma, extrusion of the obliteration material, persistent drainage, and potential hearing loss depending on the extent of surgery. Successful mastoid obliteration typically results in a smaller mastoid cavity, fewer infections, and a generally improved quality of life for the patient. Advances in the field include the use of intraoperative CT for precise material placement, the development of novel biocompatible materials, and endoscopic techniques to enhance visualization and reduce invasiveness. In conclusion, mastoid obliteration plays a crucial role in otologic surgery for managing chronic ear diseases, aiming to eliminate the mastoid cavity and reduce complications. Success relies on meticulous surgical technique, appropriate material selection, and careful postoperative care.